Hello, everyone. Thanks so much for joining. Today, we're going to walk through something that's becoming increasingly relevant to our practice. Total ankle replacement, also known as total ankle arthroplasty. Total ankle replacement is a surgical procedure increasingly utilized in the treatment of ankle arthritis. Ankle arthritis may arise from various conditions, including post-traumatic arthritis, degenerative osteoarthritis, gout, hemophilia, and rheumatoid arthritis. Among these, post-traumatic arthritis accounts for approximately 70% of cases. Ankle arthritis isn't just about pain. It's a slow, progressive breakdown of the joint's natural cushion. Inside a healthy ankle, smooth cartilage covers the bones, allowing effortless movement. But when arthritis sets in, that protective layer starts wearing away. They often come in with joint pain, stiffness, swelling, and difficulty with mobility. Management of ankle arthritis includes both conservative and surgical interventions. First up, conservative approaches encompass analgesics, physiotherapy, wearing the orthosis like tailor-made shoes and insoles, lifestyle modifications, and intra-articular injections with hyaluronic acid. But when those don't work, surgery becomes the next step. Traditionally, we had ankle arthrodesis. It is fusing the calcaneal and fibular talar joints, which comes with limited mobility and may accelerate degeneration in adjacent joints. But now, that's where total ankle replacement comes in, which can preserve more function. Total ankle replacement was introduced in the 1970s. Patients' lower part of tibia and upper part of talus were resected and replaced with three prosthetic components: a talar, tibial, and polyethylene component. The aims of total ankle replacement are to alleviate pain, reduce swelling, and restore mobility. But of course, no surgery is without risks. The potential complications include infection, wound healing issues, aseptic loosening, pulmonary embolism, intraoperative or postoperative fractures, and soft tissue injuries such as tibial nerve damage or Achilles tendon rupture. Among these complications, the wound healing problem is the top concern after total ankle replacement. As nurses, we're the front line in spotting and managing these issues early. Here's what's happening locally. You'll notice a rising number of total ankle replacement cases over the last few years at Queen Elizabeth Hospital. And with that, waiting time for the operation remains considerable, at approximately 1.5 years. Swelling control and wound management are the biggest concerns after the operation. Since the 2021 total ankle replacement case in QEH, nearly every patient has experienced swelling in the operated limb, and poor management can lead to complications, which can impact healing. That's why nursing care plays an essential role in ensuring optimal recovery outcomes. However, there is no nursing educational program, protocol, or patient educational booklet regarding total ankle replacement available at QEH currently. To address this gap, our team has created a new nursing program, protocol, and patient booklet to improve the patient journey in total ankle replacement. Here is the patient journey of total ankle replacement in QEH. The following part will explain the related nursing care in each phase. Let's start with the admission phase. Upon admission, a thorough assessment and baseline investigations are recommended. We can get a full picture of their health status before surgery, including vital signs, pregnancy testing for women under 60 years of age, allergy screening, and infection signs. Preoperative phase is also a crucial time to educate. The educational booklet and fact sheet is a fantastic tool, helping patients understand what to expect. We should reinforce them to read information from the booklet and fact sheet and address their concern. Also, we can coordinate with physiotherapists, medical social workers and dietitians if needed to ensure the best possible outcomes. Apart from the general preoperative preparation, skin preparation should not be excluded. Antibacterial agents or chlorhexidine washcloth are suggested to decrease the bacterial loading of the operative site before the surgery to minimize the risk of wound infection. During the postoperative phase, we're on high alert for falls, wound issues, pain management, pressure injury prevention, slab and Dynacast care, especially in swelling control. In immediately postoperative phase, close monitoring of vital signs, urinary status, wound condition, and surgical drains is imperative. Proper monitoring of drain includes checking for unusual output volume and ensuring system patency. And remember, if neurovascular status looks compromised, we need to act fast and report promptly. Swelling control is a major concern. Patients need guidance on limb positioning. As a short leg slab will be associated with the patients after the surgery, we should educate the patients to elevate the operated limb with a foam elevator with the heel free to prevent pressure injuries from forming and control swelling. Besides, adequate pain control, prophylaxis, antibiotic injection and slab care should not be forgotten. Also, nurses should alert the patients that weight bearing on the operated limb is restricted after the operation. Slab will be changed to Dynacast after wounds seen by doctor in early postoperative period. Drain will be removed and dressing will be done as per doctor's order. Wound management is also one of our major concerns. We should observe for the skin condition, especially peri-wound retinaculum skin tension. Anterior approach of total ankle replacement is at risk of injuring the anterior tibial artery. Increased in skin tension will further compromise blood supply to the operated site and causes skin necrosis. Adequate protection over bony prominences is also essential in preventing pressure injuries. Then patients can start non-weight-bearing walking exercises with walking aids. In discharge phase, patients are heading home, or may be transferred for rehabilitation if additional training is required. Patients are discharged with Dynacast for at least 2 to 3 weeks after surgery. Related Dynacast education should be needed. Before discharge, patients receive education on non-weight-bearing techniques associated with the use of walking aids. iWalker may be offered by the doctor to young patients with good compliance as an aid for non-weight-bearing walking exercise. We strongly encourage patients and relatives to make good use of our informative booklet as reference. However, care doesn't stop once discharged, the real work begins. Swelling control and Dynacast care become patient responsibilities. Education regarding control swelling, wound care, and fall prevention is emphasized. Make sure they know when to seek medical attention and are reminded swelling may last for 6 months after the operation. Specific instructions for Dynacast management include keeping it dry and active toes mobilization, as this promotes circulation, which helps reduce swelling and minimizes muscle atrophy. Specifically, what should not be done when wearing a Dynacast. First, avoid using sharp objects to scratch inside the Dynacast. Instead, patients should use a fan to ventilate or take medication to relieve discomfort. Secondly, do not hit or bump the Dynacast against surfaces. Thirdly, avoid self-adjustment of the cast. Patients should also know how to monitor for complications and seek medical attention if complications, such as excessive swelling, discoloration, or persistent numbness of toes, or structural damage occur. The final phase is rehabilitation. Around 2 to 3 weeks later, Dynacast and stitches or staples comes off, and rehab starts. Tubigrip or pressure garment will be provided for control swelling. The prosthetic and orthotic services, P&O, help with providing support devices like walking AFO or MC Walker. The physiotherapist guides patients through mobility exercises, which will be gradually increased over the following weeks to support recovery. Depending on individual needs, Patients may be referred to additional services such as wound care clinic if further wound management is necessary. Around 1 month after the surgery, patients can resume active range of motion exercises gradually. Start moving their ankle gently to restore mobility and prevent stiffness. As approaching 6 months to 1 year after the operation, patients can gradually resume normal activities and be allowed to start weight-bearing activities, but should avoid movements that cause heavy twisting or shearing at the ankle. It's safe to begin non-contact sports like light jogging, swimming, cycling, or playing golf, but contact sports like football or basketball are not allowed after receiving the total ankle replacement, as they pose a risk to your new joint. Nurses may face several challenges in the total ankle replacement patient care. First of all, postoperative swelling and Dynacast care require patient adherence, yet individual differences in health literacy may influence outcomes. Furthermore, not all nurses are familiar with total ankle replacement management, which may lead to inconsistent messaging. To address the above issues, a standardized nursing protocol and patient booklet are newly designed to enhance knowledge, strengthen care, and unify the message and patient education. You may scan the QR code for the details. So, we would like to share a real case with you of total ankle replacement. This is a case of a 60-year-old male who underwent total ankle replacement. He had hypertension with no poor habits. He had a right ankle mass with operation done in childhood. He suffered from right ankle deformity and STJ stiffness at the beginning. Non-surgical intervention was offered by the doctor. However, the post-treatment responses were failed. As the deformity and swelling kept increasing in size, the doctor offered total ankle replacement for the patient. After the operation, patient's right ankle was in dorsiflexion at 15 degrees and plantar flexion at 35 degrees and supported with short leg slab. Redivactorine was inserted. Upon wound assessment by the doctor, a small blister was noted on the anterolateral ankle and eventually resolved. Then patient was transferred to rehabilitation hospital with short leg Dynacast. Later on, a small patch of skin necrosis was noted on the anterior ankle after the Dynacast was removed, and the wound was assessed by the doctor. Bedside debridement was offered to the patient to remove the necrosis tissue. Here was the wound healing process. Through diligent wound care, his wound was improved significantly. Then discharge on June 3, 2024. After 2 months postoperatively, his wound still had a mild residual raw area over the anterior ankle without signs and symptoms of infection. So, he was referred to the nurse clinic after discharge for advanced wound management. At the postoperative 3 months follow-up, his right ankle remained swollen, but the anterior ankle wound had almost completely healed. The patient continued on wound management. Nearly 4 months postoperatively, his wound finally healed under advanced wound care. This case is a great reminder of how crucial our role is in ensuring recovery success. The better the swelling control education and wound management after the total ankle replacement, the lower the risk of wound complications. Through diligent wound care, physio, and follow-up, he improved significantly. Finally, here are some take-home messages of this microlearning. Total ankle replacement is a valuable procedure for preserving ankle function in patients with arthritis. While it presents postoperative challenges, wound healing, swelling control, and Dynacast care remain central to patient recovery. As nursing staff, we are integral in guiding them through the journey and ensuring the best possible outcomes. The implementation of new nursing protocol and patient booklets is a crucial step toward improving the quality of care for patients with total ankle replacement. Let's continue strengthening our knowledge and care. Thank you for your valuable time and dedication. Patient educational booklet and nursing protocol for total ankle replacement are attached for reference. Please scan the QR codes for the details.